Hello, Faustina. Welcome.
Thank you.
We are happy to have you here.
Thank you.
And I'm sure that our interaction will be an interesting one.
I pray.
Please tell us what your profession is.
Okay, I'm Faustina Asamoah, the chairperson for Midwives Group, GRNMA. Okay, so about our profession, midwifery is a skilled profession whereby we receive training. And in Ghana here, we have the diploma where we are trained for 3 years. And the degree, which started with the Kwame Nkrumah University of Science and Technology in Kumasi, also trains for 4 years. And so are the other universities, University of Ghana, Legon, University of Cape Coast, and some private facilities. And universities also running the 4-year program with degree. So it's a skilled profession that trains people to become professionals. At the end, we are called midwives. And these midwives give skilled healthcare to women that want to achieve pregnancy, after they have achieved the pregnancy, and then till the time that they will deliver a healthy baby to a healthy family or a mother. So these professionals are what we call midwives.
Okay. From what you said, you mentioned a few things, but then I would want us to break them down some more.
Okay.
You mentioned that before someone becomes pregnant, there are some services that midwives provide. Can you highlight on that for us?
Okay. So midwifery does not only cut across when the woman has achieved a pregnancy. Before one plans to achieve a pregnancy, we need to prepare the woman. We need to prepare her physical state, her psychological state, her social life, and even the socio-economic. The reasons being that if you are not strong, if your systems or your uterus, womb, what we normally call the womb, is not well prepared through nutrition, somebody has some of these nutritional issues, it hinders one from achieving a pregnancy. So before one achieves a pregnancy, we need to take the person through all these. Let's say we put the person on folic acid. Folic acid helps a woman to prepare the womb, awaiting a fertilized egg after they have had intercourse with a man, unprotected. Yes. So there is the need to take the woman through all these. And the nutritional aspect, as I mentioned, yes, we need to boost the diet of the woman, more fruits, more vegetables, nutrition specific. Yes. And then we also encourage other laboratory investigations prior to achieving a pregnancy.
Oh, that's interesting. Mostly when we hear of midwives, we only think about pregnancy and childbirth.
Pregnancy. So we have the pre-pregnant state.
Okay.
And then whilst you have achieved, how we can maintain that pregnancy throughout the 9 months before you deliver.
That's fine. Now, let's imagine someone is pregnant now.
Okay.
At what point in a pregnancy should a person see a midwife?
Okay. So the ideal is as soon as you miss your period, you need to see your midwife or the gynecologist. A number of times people get pregnant and they stay in the house for so many months before they come. You know, as soon as you get pregnant and then you start antenatal clinic, there are so many basic things you do that helps the woman and the unborn child. We put you through laboratory investigations. We do your physical assessment. We also help you psych your mind, because this is the time that all these hormonal imbalances start replicating. So we need to psych you in all these aspects, such that the baby is well protected or baby is well observed or monitored while in utero, and as well as the mother, because you need to eat well, certain medications that you don't have to take while pregnant. Especially most issues crop up in the first trimester, which is a delicate stage. So if you don't go for the antenatal clinic, we may not be able to rule out some of these things. You know, people have candidiasis, some have syphilis, other sexually transmitted infections, which need urgent treatment so that they don't cause any harm to the developing zygote or embryo. Yes.
All right.
So it is crucial that a woman attends the ANC as soon as she misses her period, because sometimes too it may not be necessarily really pregnancy. You know, fibroids and ovarian cysts sometimes behaves like pregnancy. So if you don't assess clinic, especially in women who have been trying every means to get pregnant, once they miss their period, they may feel they are pregnant, but it may take some time for you to know that it's not probably or basically the pregnancy, but another thing. That is why it is one of the reasons why you also need to assess the ANC, for us to do scan and other things to determine that yes, or confirm that yes, there is a pregnancy, and then the care and monitoring starts from there.
All right. I'm sure that when someone becomes pregnant, there are certain things that they should take care of. I mean, certain things they should do, certain practices that will help them to have a successful childbirth. Can you highlight a few of such ones and things to avoid?
Okay. Well, if pregnancy has no complications, then of course it does not stop the woman from doing any other thing. Let's say a woman achieves a pregnancy. Yes, the nausea, the headaches, the early mornings, the sicknesses as we call, they are normal because of the hormonal changes. Yes, but after the first trimester, in most pregnancies, they stop. But some don't even get it at all. And there are some women who also experience these throughout the 9 months journey. Yeah, so depending on the state or depending on how the woman feels, if it is not complicated, then you can do any other thing. However, we have people who vomit throughout. So for them, we normally manage them. They are normally hospitalized. And then we monitor them. We put them on IV fluids, intravenous fluids, to compensate for what they are losing, because they eat and then they throw out. So we don't give any food by mouth, but we give through the injections. Another thing too is if the woman is bleeding in early pregnancy, which is a danger sign, we admit the woman, then we monitor. If it is a threatened abortion, we take a scan and then we know that, okay, baby is still fine, just that there is some kind of bleeding. So we keep you in bed and then we don't discharge you home. You are with the nurse or the midwives at the facility. The doctor monitors you, you do lab, we do scan to ensure that baby is fine in the utero. And then we are giving medication to also stop the bleeding. So after that, if the bleeding stops, we normally encourage or educate that this woman stays out of sex, because the likelihood of she bleeding more could be high subsequently. But after the 6th month, if nothing is happening, sometimes the woman carrying the pregnancy because of fear, yes, may decide to stay off sex throughout. Or even the man may even, propose that let's stay off sex, especially if it's a pregnancy belonging to a couple that have been searching or looking for the fruit of the womb. Yes, they want to protect that pregnancy. Other than that, in the absence of all these complications, one lives her normal life. You eat any food you want to eat. you sleep well, you do passive exercises, you drink more water, you have sex throughout, and yes, pregnancy ends well.
There are some times that I hear that some people use some herbal medicine. They say that they want the child to become big, so they start, when they become pregnant, they start taking some herbal medicines. Can that also have any effect?
Yes, herbal preparations have an effect on pregnancy, in the sense that most of these herbal preparations, we don't know the potency or the efficacy of it. And normally you see, you cannot also measure them. Some tell you, pour it into a cup, as to which graduation of the cup that you need to pour.
My cup will definitely be bigger than yours.
Exactly. Some use bigger cups, others use smaller. So which dosage exactly are you taking it? So that is what poses the threat. We don't know the ingredients in them. Were they even measured in the first place, used in the preparation of these herbal preparations? So these and many other factors are what causes dangers to pregnancy, especially in the early stages. Yeah.
All right. Now, let's imagine someone does all the things she needs to do. She exercises, eats well, I mean, all the healthy practices a pregnant woman should do. And now she's in labor. Can there still be complications?
Yes, it does. You know, one thing is that labor itself cannot be predicted. Somebody can carry pregnancy from day 1 to 10. She comes into labor, everything was fine, but within less than 3 hours or 4, you realize that the condition has changed. That is what we call, that is why normally we call something the emergency CS. You realize that she was okay. So maybe the relatives may come back later and they go like, my wife was brought here, she was progressing, and then I just went to buy something, I came back, they had sent her to theater. They don't understand. Because sometimes it is through, it is during labor that you realize that the fetal heart of the baby has changed. It is now reducing below 120, which is a danger sign, or above 160. We call it tachycardia. That is a rapid heartbeat of the baby, or it is going down. Yes, it is. It's an alarming sign that we need to do emergency CS. Sometimes you realize that baby has passed stools into the water or the liquor covering the baby in utero. So as soon as the membranes rupture, you see the feces, the greenish stools mixed with the liquor. It's a danger sign. It means baby is in distress. Sometimes too, you realize that the cord that is supposed to come after the baby has been born is now leading. It's a danger sign. Or sometimes too, you realize that client is just 1 cm or just in the early stages of labor and membranes have ruptured. It means baby, it's a danger sign to the baby. So mother can be fine and everything, but gets into labor and things may decide to change within a twinkle of an eye. So we have such cases as well. And sometimes if it ends bad, they may not understand and they attribute it to the fact that the midwife abandoned the woman, the midwife did not do her work, And we have a tool that we use to monitor labor. When you go to the labor ward, we have some sheets. Sometimes you see some graphs and all that. People don't understand. That is the midwife's tool. We call it the pathograph. That is what we use to monitor and assess the progress of labor. So we have the maternal record, we have the fetal record. So on this photograph, that is what is going to guide the midwife or any obstetrician who comes around to see that, okay, this one is progressing. She came at this time, and at 5 o'clock, she is here. Okay, at 5 o'clock, she's not progressing well, because every 4 hours, it is estimated that the woman is supposed to dilate. Yes, every 1 hour, 1 centimeter, 2 hours, 2 centimeters. So by the next 4 hours, she should be progressing steadily. But sometimes realize that within 8 hours, she's only dilated 2 centimeters. And there is an obstruction there, and we need to take caution. Yes, so we use all these tools, and sometimes what we face is that they go like, since I came, she's been writing plenty. I don't even know what she's writing. Yes, documentation is key in this our work. If you don't document and you are sent to the court, yes, you will fall prey to it, because documentation is key in whatever we do. If you want to monitor the progress of labor, it's all, bent on the fact that you are doing proper documentation, whereby you need to take the necessary action should there be any deviation. Yes.
All right. So you talked about complications.
Yeah.
So should pregnant women be scared?
Should they be scared?
Yeah, because if there can be complications, should...
Yes, like I said earlier, pregnancy can never be predicted. Nobody knows the outcome of delivery until it is done. We can only tell you that, okay, you took a scan and this is what was there. Most times you come into labor and you get a different result. That should tell you that it is the work of God and not man. Yes, we can monitor, we can assess, we can do other things, but the outcome of it doesn't lie in the hands of anyone. So as we come into labor, I urge the family members, the society, the woman, the husband, that we should all pray, and then we also anticipate for anything. Yes, because the kind of thing that happened mostly is not 100% the fault of the midwife. However, there are other exceptions, yes, but it's not solely the fault of the... I have nursed a woman who walked to the ward herself. She carried her stuff, came in, and she had packed everything beautifully. They were smelling good. This was a very neat woman who came in there. She came there, and in less than 5 hours, she progressed. We positioned her to deliver her child. As soon as she climbed onto the delivery bed, condition changed. She couldn't breathe. We gave oxygen. She couldn't push because baby's head was there. She was so, laxed and couldn't push. So in the next second, baby was out and this woman was going. Resuscitation, we did suctioning. We were rubbed, the placenta is there, so you cannot rub the uterus. We had to deliver the placenta. This woman was just breathless. And she popped off.
Oh.
Baby came out asphyxiated because of that. She was almost dying before the baby came out. So baby was, asphyxiated. We had to resuscitate and send baby to NICU, but the mother went off. So relatives came. What happened to her? We brought her alive. She walked in here, but nobody could tell. But like I said, all these emergencies are there. They happen once in a while. Sometimes you see somebody you see somebody the next 5 minutes, oh, she passed on. What happened? She was just drying her things, and yes. So we anticipate all these things in the course of our work, despite the fact that we pray that nobody dies in our hands. But it does happen sometimes. I have never had any mortality in my 14 years of practice. Not even a baby or a mother. And it's just by the grace of God. But it can happen. Yes, just that God has been grateful to some of us here.
I'm sure, but I'm still sure that with the training that you've had, I'm sure sometimes when you face difficult situations, you know how to handle those ones. Like, I mean, once you've had training, sometimes even difficult situations, you're able to,
Yes.
with the experience and then the
Sure.
training, you're able to handle those ones. Because we don't often hear of these maternal mortalities.
Yeah.
Like you mentioned, it's just once in a while, but
But these
for-
days, I think the data as at 2020 to date has gone down a bit. Yes. And I believe our midwives are doing their very best. Yes, with all the training, the workshops, and then the upgrade. Yes. They are doing the applications well, and I believe it's one core reason why these mortalities are reducing over the time. Yeah.
what about instruments for work? I mean, how advanced are we, and are these also helping improve maternal mortality? Like, because I'm sure that definitely, looking back, yes, and then comparing to now, we should have made some progress.
Yeah, well, in provisions of logistics, yes. I mean, there has been an improvement, but not enough. Yes, there has been an improvement. And today in my speech, I made mention of some of these. You see, Ghana has come far to be using some old and archaic kind of logistics to be working. It looks like we are doing more of manual work than these technological, equipment. And we should look at that because there is population increase, ratio of client to midwife is still high, and we are still doing manual. So these professionals are human beings and they get tired doing the manual. If you have been to the facilities, you will see midwives using the vuvuzela. I mentioned it today. And imagine if this midwife is taking care of 50 people at the antenatal. She's using her ears to be listening to this and be counting 10. So what time is she going to finish with one woman before she moves to the next? So it makes the work tedious. These days, BP apparatus that are supplied in the facilities, they use batteries. So you check, you use it for 10 people and battery falls. You don't have battery. You go to the stores, they tell you they don't have batteries. So where do you go? We should always be up to the game. We should always be the game changer. We should always, be to the core. It should not always be the headache of the midwife or the doctor or whoever all the time. The management too has a role to play. You don't expect me to use my salary to buy logistics and it won't happen.
Your little salary.
You see, it can't happen that way. So I think that's just for that point.
Yeah. All right. So you've taught us a lot. Like your work involves before pregnancy, during pregnancy, and after. Now let's talk a little about the afterbirth.
Okay.
I want us to focus on breastfeeding.
Okay.
How important is it for parents to breastfeed their children, their babies, mothers to breastfeed their babies?
So, with breastfeeding, I will start with the God factor. You see, this is a sack that was empty before your pregnancy. There was no water in it. You got pregnant, it became heavier. It got loaded. As soon as baby came, water has started gushing out. So it should tell you that God has designed it purposely for these ones. Because when you were alone and walking about, there was no water. But you took pregnancy and it became tender. Now you deliver and there is milk. So it's for that particular child. So why don't we give it? So I always have issues with people buying other things. Breast milk is very good for the baby. It contains all the banku, all the abenkwai, all the abedru, all the snails, the mushrooms, the what chicken, the jollof etie. Everything you take as a mother, which you love so much, is there for the baby. So imagine you don't give it to the baby. What are you doing to the baby? The formulas that you buy, do they have that rich thing? You see, the thing is watery. So you know, normally when the baby is out, the first milk that comes is yellowish like that, colostrum. It contains a lot of probiotics. Pro means the proteins, the vitamins, the minerals. Everything the baby needs, and it contains that pigment that the baby needs to clear the baby's bloodstream off. So when you don't give this breast milk to the child, you are depriving your child of all these essential nutrients it needs to grow. And believe you me, when you deliver, the baby at birth does not have any good immunity. So if you don't build it well from the onset, the baby grows with it. Yes. And normally when a woman breastfeeds very well at birth, it prevents the child from getting jaundice, because the baby is getting almost every nutrient it needs adequately. And it builds the brain, the skin, the heart, the lungs, everything. Every organ of the baby gets well built. So it is necessary that we breastfeed, and breastfeed on demand. When I say breastfeed on demand, it means that as and when baby needs it, give it. Because you as an adult, you eat as and when you need food. You drink water as and when you need water. So why don't you breastfeed the baby as and when it needs it? And then again, the woman must eat well. As you eat well, whatever you eat, that is what the baby gets. So you need to boost your nutritional state, and then the baby can get enough to also build its own immunity. Yeah.
That's fine. What about in the first few, sometimes I hear sometimes some mothers, for the first few hours, the milk isn't coming. So in a situation like that, what do they do?
Okay. So what happens is, we have some few mothers who have an issue with lactating immediately the baby is out. One trick is, when the baby is delivered and you don't put the baby to the breast, it doesn't come. Remember, the breast milk is sensitive. It takes messages from the brain. So if the baby is born, you haven't put the baby to the breast, there is no jaw or no lips holding it. It has not sent any impulse to the brain that I'm out, so release me. Yes. So the moment you breastfeed or you attach baby to the breast, an impulse is sent to the posterior part of the brain to release the milk. Exactly. So normally when they deliver, what we do at the labor ward is immediately we remove baby to onto the mother's abdomen. We put baby to breast. Normally you see them trying to even grasp the breast themselves to hold, that kind. So as soon as the baby has that edge, you encourage the mother to put the breast there. The midwife holds the baby to hold the breast, and then you see them suckling. But on few occasions at the theater, mothers that undergo cesarean section, they delay in breastfeeding because at the theater, they are in pain, they come back from theater. However, some anesthetists within the theater setting, inside, while the surgery is ongoing, when baby is removed, we put baby to breast, they hold the babies for the mothers, and they start lactating from there or attaching the baby to breast. So when they come to the recovery, normally based on the pain, yes, mother is in pain, anesthesia is there, they are shivering, you want to cover them, so those inconveniences. But after 6 hours, you can encourage the mother to lie on her side, then you put the baby to breast. But on few occasions, some have theirs delayed for more than 24 hours. So with them, we only give the formula, but after which we encourage them to put the baby to breast. So upon discharge, they don't go home with a feed.
Okay.
Yes. If you are on my ward and you go to buy the full tin of whether SMA or NAN1 or whatever, if you are going home, I take it from you. You can fight me, I don't care, but I will still take it from you. But I make sure that you are lactating before leaving the hospital environment. The reason being that when you leave it for them and they go home, those doctors and midwives in the house, their in-laws and their family members, they are more than gynecologists and midwives. They will encourage them to finish that whole thing, and they don't breastfeed. So baby comes back to the postnatal within 3 days and they are jaundiced because they are not getting the essential nutrients they need. Yes. So we don't encourage the formula. We can give it to you at the hospital, but we encourage the breastfeeding. And it's so convenient. And I tell mothers that, you see, if you are breastfeeding at night, you don't have to wake up every 2 hours to go and boil water, take cup, prepare, when you finish, wash. It's just a waste of time. But you can give your breast, finish, put baby down, and you all continue sleeping. It's convenient. Yes. So we encourage the breastfeeding, and they know the importance of it. Yeah. And mothers who have done exclusive breastfeeding testify the difference between their exclusively breastfed children from those that they added the formulas to.
Tell us about the exclusive. You mentioned the exclusive. What does it mean?
Okay. Exclusive breastfeeding is feeding your baby right at birth to 6 months without adding any formula, no water, nothing, only breast milk. And in this case, you feed on demand, like I said earlier. You feed every 2 hours, and you make sure that at least you feed 15 times in a day. Yes, satisfactorily, such that the woman gets time for the child, sits down, positions herself, attach baby, ensure baby is suckling the breast. And I work at the postnatal department, and I keep telling mothers that Ghanaian mothers must be sexy and romantic. You see, if your husband, or yes, if your husband can give you a kiss, can rub your cheeks, rub your back, rub your hair, and then you open freely for him to enter, you get it. Then of course, if your baby is not opening its mouth for you to put the breast into its mouth, what do? You need to stimulate the child. As you rub the cheeks, massage the hair, try to rub your hand on the forehead. Baby feels being romantically massaged, and they open like that. You see, but our mothers don't know how to do these things. Baby is not opening their mouth, and you see them forcing child. But when you put the hand here, you try to stroke the feet, they open widely for you. Sometimes as you stroke, they open to cry. So the moment they open, you just push in the nipple, and baby grasps, and there you are. Yeah.
Let me ask this. You said exclusive involves no water. No water at all. Will it not harm the baby?
The breast milk is watery. It's full of water. So God has made it such that it's packaged. Imagine you taking Coca-Cola when you are hungry. It contains sugar, such that your sugar level will not drop. In effect, it contains water. So if you don't get water at that moment, but this one contains water per the component we all know. It contains a larger amount of water. then other vitamins God in his own wisdom has designed. So the woman only needs to fuel it, and the fuel is the nutritional aspect that she has. That's it, to make it 100%.
Okay, so after the 6 months, now mother can introduce food.
Introduce food, yes.
So until how long before they stop breastfeeding?
So breastfeeding ideally is supposed to end 2 years. 2 years exclusive breastfeeding.
Okay.
But most mothers are not able to achieve it because of the workload, especially if you live in Accra, where you need to go to work and all that, and especially if you mistakenly conceive in the course of the breastfeeding. Yes, you cannot do the 2 years. You need to stop at a point to have time for yourself and the next pregnancy. And that is why we keep on hammering on family planning after delivery, so that you don't welcome an unplanned pregnancy. So these are some of the factors.
Yeah. If we want to talk about your work as a midwife, we'll keep on going on and on and on. We may never end. So let's quickly talk briefly about your association. You mentioned that you are the chairperson for the Midwives Group of the GRNME. When did that one start, the Midwives Group?
Okay.
How long have you been there? I mean, tell us.
Okay. So we started 4 years ago after one woman decided to take away midwives within this association, to break away to form another association. So some of us, we were a team of 4, which I led then, to make a press statement against she taking illegal deductions from our salaries on the controller payroll. So we made a press release, and in June 2017, we were able to pull over 3,500 members from that association back to GRNMA. Before that was done, the number within GRNMA was less than 2,000 members midwives within GRNMA. As at March this year, 2022, we are over 12,000. Yes. And since then, the association has been rallying behind me and my executives, and we are here today, and we had our conference, and this has been one of the great visions I've had since that time, to make sure that midwives also have a voice. We stand tall within the GRNMA, because what I realized was that in the past, because we did not have reps within the GRNMA, that was what the woman or the other person was riding on to break away to, people are making money out of their political or selfish interest, yes? Of course, when you are leading a group or taking dues of members to form an association, it's all about money. You are taking dues and monies are accruing, and then you're going to make a lot to enrich yourself. So that was what we realized. So that was what I didn't also support. And then we are here today. We've had our conference, our maiden conference since. This is our first time. And GRNMA is 60 years, and this is the first time such thing has ever happened in this association. And I'm proud to be a leader of it, yeah. So that is Midwives Group. We have several groups within the GRNMA, and we are called the specialized groups. So we have the critical care nurses, ear, nose and throat, ophthalmic nurses, certified registered anesthetists, community health nurses, public health nurses, general nurses group, under which we also have the Midwives Group. So we realized that since 1960, we didn't have a midwives group. So in the past, the general nurses were kind of speaking or doing things in favor of midwives. But because they also had their issues, so when they come for meetings, they speak for themselves and they had their things done. And that was what was missing in the association which I felt that woman should have done. So she started that, and when she realized she was getting more than best, she broke away to form another association and be taking the monies to herself. So it was on this course that I saw, and then God used me to bring us to where we are today. Yes.
I hope your group is not going to break away sometime in the future.
They can't, because okay, that would be when I'm no more part of them. Yes, but until I continue to live, I love the unity kind of thing, because I believe in unity lies the strength, as our slogan goes. Yes, nurses and midwives are doing a lot in this country, in as far as the health sector is concerned, but we lack that unity. We are not united. In the nursing profession alone, we have other associations. So the question we keep asking is, how many associations have the Ghana Bar Association who keep preaching about freedom of association? How many associations do they have? They still have one, the Ghana Bar Association. Ghana Medical Association still have one, despite their professors, the consultants, the other specialists, whatnot. They still see themselves as doctors belonging to one association. So they have the voice. When they speak, government shake, their employers shake. But is that the case of nurses and midwives? They break our ways, are breaking our fronts. And that is what the employer and the governments that come and leave all base their strength on, because they believe that when this group is not working during strikes, others will be working. So they don't feel the heat, they don't feel the impact. And that was what we saw in 2020 when we declared our strike. Just when we started, another association for midwives issued another letter that midwives are not nurses, therefore we should go to work, and then we should allow the GINMA. Meanwhile, it is the GINMA that has the bargaining power to negotiate for every single nurse in Ghana in active service. So where is the point of belonging to any susu group who doesn't have any bargaining power to negotiate for you? So if we are striking as a group, as a team, as an association, and the government will feel the impact to do the needful, because they have been riding on our backs for far too long, because they feel we cannot bite. So that is it.
That's fine. It's, like you mentioned, unity is strength.
Yeah.
So that's really important. So what should midwives expect once you've been here for 4 years now, you've had your maiden conference. I mean, what should midwives expect? What should the general public also expect?
Okay. So, in as much as the general public expects more from us, we also expect much from them. Yes, we are ready to deliver. But we all believe that where your heart is, that's where your treasure should be. Yes, so as they need us, we also need them a lot. We need them to rally behind us. When we give them the education, it should not go waste. Because sometimes I feel we talk more, we give more education, but it doesn't get anywhere. Because even in our facilities, you tell a woman, you give her this medicine for the baby's cord. After giving her all the education, they go back home, come to the facility, and you will see Pepsodent used on this cord and bandaged. You ask them, they tell you, it's my in-law. I was like, madam, were you not here when I gave you this? She was like, I was here. So what happened? My in-law, my mother, my auntie, my sister. So it's painful when you are giving and we are not taking back. It's so painful. So in as much as they need more from us, we also plead that the education we give should be taken seriously. Because when the effects come, they kiss the greater part and we also get our share. Yes. Then again, the government must also do as we have asked. We keep asking, but the support that comes is not enough. We'll continue to ask and plead, and then we ask that they respond to our needs whenever necessary, because we are doing the best that we can. Yes, so that's all I can say for.
Thanks a lot. Now you've taught us so many things. We've seen the work of the midwife. We've seen what mothers should do, what we can all of us, what we can do to help make your work easier and make things easy for us. I'm sure that all those watching will learn something from what you've taught us, and then we'll definitely apply the things that you've taught us. And I'm sure that, in the years to come, midwifery or midwives, your condition of service, everything will also improve and things will become better. Thanks a lot for the time you spent with us.
Thank you so much.
We are grateful.
Right.